Hi there, I'm Dr Nicole White. I'm a GP based in Brisbane, and in my practice GP for Kids I look after young children and their families. During this period of isolation I've been learning some new skills, and one of them is how to make a video blog, so I'm going to give it a go. This is the first episode, and today we're going to have a bit of a chat about whether or not childcare is a good idea during this time of the coronavirus pandemic. This is a question that I get asked a lot by families, and I've had this conversation numerous times in the past week or so. Should I send my child back to childcare? We're going to look at this from a few different angles and have a chat about a few points and current evidence that might help you to make that same decision. First of all, we're really lucky in Queensland and in Australia in general, in fact, that our numbers have been so low, and this is due to the social distancing measures and the flattening of the curve that we've been able to do. So we're seeing very few new cases pop up in Queensland every day, and this means that the risk of community transmission or picking up the coronavirus in the community is very low, including in childcare centres. So the spread of the virus in childcare centres at the present time, in early May, is likely to be very, very minimal. The second thing to consider is that the evidence from around the world tells us that children aren't really getting coronavirus very often, or are certainly not testing positive at a very high rate. And those who do test positive don't tend to get very severe illness. There are always a couple of cases that are outside this rule, but generally what we're seeing is fairly mild disease in young children. Another thing that we've seen from this pandemic is that people have become more aware of good hygiene measures like hand washing, covering coughs, and most importantly, staying at home when sick. So children are not currently attending childcare when they are sick, and therefore we're seeing lower spread of everyday viruses. We've seen very few children with coughs and colds, and we would normally be starting to see more of this at this time of year. So that's also reassuring in terms of the safety of the childcare environment at the present time. So I guess we know that the numbers are low. We know that the spread among children is considered to be low. We know that children don't tend to get very severe disease. And we know that as a community, we're practicing good hygiene and we're keeping our children home when they're sick. So I think at the moment, on the balance of things, the risk of sending your children back to childcare is probably low. Now, this is a decision that each family has to make based on their own situation and what they feel comfortable with, but hopefully some of these facts may help you make that decision. The other point I'd like to make is that if you are going to send your child back to childcare, please get a flu vaccination for them. Any child over the age of 6 months can have a flu vaccine, and I'm going to be making a video about flu vaccine in children shortly, so keep an eye out for that one. The other thing is, play by the rules, and if your child is sick, please keep them home until they're well. At the current time, if your child does have a runny nose or a sore throat or a fever, they will need to be tested for coronavirus. But regardless of whether they test positive, they should stay home until they're better to prevent the spread of other viruses as well. So, good luck making this decision. Stay safe, everybody, and thanks for listening. Bye.